Hello everyone, it's Dr. Dave. Hope they're all doing well. You had a nice start to your week. Looking forward to your day or week ahead. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update. It's Tuesday, May 11th, 2021. Going to look at 6 areas of health and wellness today. Somewhere around this video, you can read through all 6 areas. If you would like a copy, DM us on social, give us a call here at the clinic, or send us an email. We'll be sure to get that to you. It's always a good, quick read to help keep you focused on your health and wellness choices throughout the day. We will not be treating, diagnosing, preventing, or curing any illness or disease with our time together today. However, we promise to share with you some of the latest and greatest in the research and literature when it comes to health and wellness concepts so that you can stay plugged in, tapped in, tuned in, turned on to some good health information to support your own health journey, either to get better and or to stay better and or to help those around you do the same. Always time, effort, and money well spent. So the Canadian Medical Association Journal, April 2021, talked about blood pressure medication potentially raising skin cancer risk. So you can read through that. Interesting correlation, very medical. If you have any questions or concerns beyond the article that you can maybe find on the internet or online, be sure to talk to your healthcare provider, your medical or family doctor. The journal or report from Science Advances, April 2021, looked at an interesting concept for people who are trying to drink less or to stop drinking. They found that the keto diet helps ease alcohol withdrawal. So especially for alcoholics who might be looking to overcome their addiction, a recent study found that switching to the keto diet could help curb withdrawal symptoms. So good to know if that's a strategy you're trying to do for yourself to make yourself healthier and maybe your life a bit better. The International Journal of Environmental Research and Public Health, April 2021, did a report that, based on findings from a 5-year study that monitored the physical activity of over 300 older adults, they estimate that exchanging just 10 daily minutes of sedentary activity for moderate to vigorous intensity exercise can reduce the risk of death in the next 5 years by up to 10%. So take away 10 minutes of your sedentary time, replace it with moderate to vigorous intensity exercise for 10 minutes, and you have a 10% less chance of dying in the next 5 years. Maybe if you took 100 minutes of your sedentary time and exchanged it with 100 minutes of moderate to vigorous intensity exercise, you might not die in the next 5 years, guaranteed. I'm sure that's not how it works, but it's always interesting to poke fun a little bit at research and literature. But nonetheless, the concept is sound, no doubt. Our body enjoys variety. We do have to rest, hopefully, when we're sleeping. And during the day, we do want to stay active, physically, chemically, and emotionally active in a healthy way. And that's why we want to engage our body in some kind of movement-based activity throughout the day and also provide it some healthy nutrients. All of that in moderation and variety will be good for us. All right, so just 10 minutes. Switch 10 minutes, you'll be good to go. The Nature Communications report, April 2021, looked at snoring and how it may be a contributing factor to a child's behavior. They looked at over 11,000 preteens, and it revealed a link between regular snoring and behavior problems. It also was correlated with reduced brain volume in the areas linked to problem solving, impulse control, and social interactions. So a good quality sleep, not just getting enough sleep on the clock or putting them to bed, but also ensuring that the sleep is of good quality, can help improve a child's development and their function. The Asian Pacific Journal of Cancer Prevention, April 2021, looked at one of our favorite nutrients on the Daily Health Update, vitamin D, and they found a deficiency could be linked to liver cancer. A meta-analysis of data from 11 studies concluded that vitamin D deficiency may double an individual's risk for cancer of the liver. So again, good to have your levels checked if you haven't already, and then work on getting them into a healthy zone. Finally, Pain Management Nursing, February 2021, looked at too much TV and heavy backpacks being linked to back pain in children. Among a group of over 370 children aged 6 to 12 years of age, researchers found that 27% had experienced back pain during the previous month. Further analysis showed that for every kilogram increase in backpack weight, a child's risk for backpack pain increased by 45%. the data showed that kids who spent 3 or more hours a day watching TV were over 7 times more likely to report back pain. So there's that sedentary component kicking in, not good for our body function. And if we add in extra challenge by carrying something heavy and how we carry it, quite often incorrectly, with how the backpacks are worn and the kind of backpack that is used, could lead to early onset back pain challenges that become a chronic lifelong problem potentially. So in order to set our young ones up well, we want to make sure that they're only carrying what they need, and if they need more than they can realistically carry, then they should probably be using a roller device, something that they can push instead of carry. And then also cut that screen time down, or at least break it up, like we would recommend with someone who does have to do computer work and desk work throughout the day. It's probably no different. We do want to take those breaks. So if your children and you have decided it's okay that they engage in technology and media, it's totally fine. But just how they do it may be very important. And what they're engaging in, I think, is still important, but that's a whole other conversation. But to break it up, make sure there's breaks distributed in between the time that they are engaged with media or technology is very valuable, and that habit will support them well through their life, because many of them will obviously be engaged with technology for time to come, because it's probably not going anywhere quick, right? So habits, which is what the daily health update is all about, making sure that your daily habits do involve some component of health and wellness. So we're happy to share that with you on a daily basis, as we tried to do today for your Tuesday. And hopefully you found it useful and interesting. And we'll be back tomorrow, Wednesday, middle of your week, with your next daily health update. Stay tuned in, stay plugged in, and stay healthy and well just by creating some momentum. Learning some stuff every day is a good idea, not only in what you're focused on every day with your work and your other activities, but also always have that health component in there. You'll be glad that you did. Trust me. All right. Enjoy. Be well. Catch you tomorrow. Take care.